Hello, my name is Tanirbergenova. I am an English teacher in Agoraphobia Humanitarian College. Today I am going to speak about phobia and its types. I will try to describe and analyze phobias and frightening situations. In these presentations, learners discover that a phobia is a fear of a specific kind of place, object, activity, or situation.
A phobia is a situation of fear during an activity or thing that causes the person to want to avoid it. There are three types of phobias: specific phobias, social phobias, agoraphobias. Specific phobia, extreme fear of a specific living thing, object, or situation. Criteria: individual experiences excessive and persistent fear of a specific object or situation and has feelings of an anxiety, fear, or panic right when encountering it. The person knows that their reaction of fear is unreasonable. Individual's fear, anxiety, or avoidance causes significant distress or it interferes with the person's day-to-day life. In children younger than 18 years old, the problem must be present for at least 6 months before diagnosing a specific phobia. The person's fear, panic, and avoidance aren't better explained by another disorder. Types of specific phobias: animal, fear of animals; natural environment, fear of heights, storms, and being near water; blood, injection, injury, fear of seeing blood, having a blood test or injection, watching medical procedures; situational, driving, flying, elevators, and enclosed places. Other specific fears. Causes: learning history. Direct learning experiences can begin following a traumatic experience. Observational learning experiences learn to fear a situation by watching others show signs of a fear in the same situation. Informational learning, learning to fear an object or situation by hearing or reading that the situation is dangerous. Attention and memory. People with specific phobias tend to pay more attention to threatening information that relates to the fear, also tend to have distortions in their memories for encounters of fear. Beliefs and interpretations. People with specific phobias tend to hold beliefs and to interpret situations in a way that increases anxiety. Avoidance and other behaviors. Avoidance of fear prevents people with specific phobias from learning that the situation they fear are not as dangerous as they think it is. Biological. Sometimes the phobia may run in the family and genetics may play a role. When exposed to fear, biological changes occur in the body and this can increase physical symptoms. Treatments. Exposure to feared situations. Confronting a feared situation repeatedly until the situation no longer triggers fear. This technique. Applied muscle tension. This technique is used specifically to treat people with blood and needle phobias. Combines exposure to blood and needles with exercises that involve tensing all over the muscles of the body, temporarily raises the person's blood pressure and prevents fainting. The next type is cognitive therapy. Learning to identify one's anxious thoughts and to replace them with more realistic thoughts. Biological therapy. Selective serotonin reuptake inhibitors such as paroxetine and similar medications. Anti-anxiety medications such as diazepam and related drugs. The second type of phobia, social phobias. Individuals with social phobia are very fearful of being in a performance or social situations. The anxiety they get is either due to the feelings of being judged by others or behaving in a way that could cause embarrassment. Causes. Heredity. In many cases, the individual's parents have social phobia, which results in their children having it as well due to their genetics. Environmental. When children live in certain types of environments, they are affected and behaviors can change. Neurological. A chemical imbalance can occur within the brain which causes a social phobia. The imbalance of serotonin in the brain cells can because social situations can be seen very frightening for the individual. Symptoms. Physical symptoms: blushing, shaky voice and trembling of hands and feet, sweaty or cold hands, panic attacks, muscular tension, diarrhea, confusion, difficulty making eye contact. Cognitive symptoms: fear of being judged or criticized, anxiety or fear of having attention put on you, the belief that others see you as anxious, weak, crazy, or stupid, fear of meeting strangers, fear of authority figures. Personality traits: low self-confidence and self-esteem, negative thought patterns, undeveloped social skills. Treatments: medicines: paroxetine, sertraline, fluvoxamine, fluoxetine. Therapies: two types, group and private. By taking therapies, the person will be able to learn to face social situations and key ways on how to stop avoiding them. Learn different exercises you can do to control your symptoms. Analyzing negative thoughts. A major symptom of someone with a social phobia is having anxiety caused by negative thoughts. Individual has to ask themselves why they would be so scared to do certain things. The third type is phobia agoraphobia. Agoraphobia is a fear of being outside or being in a situation which one either cannot escape from or escaping would be difficult or humiliating. Characteristics of agoraphobia. There are two characteristics that are associated with this phobia. Anxiety. It starts to develop for people with agoraphobia when they start to think about being in a situation out of their comfort zone. Panic. When people avoid these situations, it brings them to panic and anxiety. How agoraphobia is diagnosed. A mental health professional diagnoses agoraphobia by taking a personal history from the client patient. No physical conditions that can be met to determine if someone has agoraphobia. Treatment. There are three ways agoraphobia is treated: therapy, medication, both therapy and medication combined. So, we have learned that a phobia is an excessive and irrational fear reaction. If you have a phobia, you may experience a deep sense of dread or panic when you encounter the source of your fear. The fear can be of a certain place, situation, or object. Unlike general anxiety disorders, a phobia is usually connected to something specific. Thank you for your attention. I hope you could learn something about phobias during the presentation.